Physicians of Reddit, what's the worst injury you've seen at a routine checkup? Not a physician, just a medical student. We had a guy come into our neurosurgery unit after he crashed and fell off his bike. After the fall he got up and felt fine and his bike worked, so he got back on his bike to ride 12 miles to his friend's home. When he got there he felt a bit of pain in his neck but thought nothing of it, and he rode on his bike again all the way back home. So good 30 odd miles. At home, he told his wife about the fall and she made him come into the A&E for a checkup. He had no visible trauma marks on his face or neck, but long behold, CT scan showed a atlanto-occipital joint dislocation. To this day I don't know how he managed to bike all those miles without noticing anything. One of my friends ended up writing up his case and presented at a conference. Eli 5. Man fell off his bike, thought nothing of it and kept on riding his bike, only to find out later in the day that his skull and body weren't attached together except for the soft tissues, that is, spine and muscles etc., which could easily tear, resulting in instant death. Nurse here. Patient comes into outpatient clinic for a checkup post-surgery. His background: he got thrown through a plate glass window in a bar fight, slicing off his ear. Instead of reattaching it right away, they made a pocket in his abdomen to hold it for a couple weeks so it could revascularize. After they reattached the ear, they sent him home for a week or two before his next appointment. So he comes back for a follow-up. The ear looks great, but the incision on his abdomen is really red and swollen. Patient admits that he has gone surfing a few times since he's been home, despite us telling him not to. Doc presses on his abdomen, and a bunch of smelly PC water shoots out his incision. Patient's response: can't keep me out of the water, mate. TLDR. Guy goes surfing after surgery, gets seawater trapped in body leading to mega infection. Well, I'm not yet a medical professional. I'm actually a nursing student, but I had a large portion of my practice time in the emergency room. Anyway, we had a guy come with a shirt covered in blood wrapped around his head. The guy claims he was walking down the side of the road when someone threw a metal pipe at his face. I got a PA to remove the shirt so we could have a look. Turns out the pipe hit him right over the eye, breaking the frontal and zygomatic bone, rupturing his cornea and his retina. He also ruptured a bunch of blood vessels to where the accumulated blood was causing a constriction on the nerves and blood flow to the eye. Nurse here. I work in eye surgery. We had a 17-year-old come into the clinic for an exam. He was having trouble seeing the board at school. He has a detached retina. Strange for a healthy teen. They send him to our retina specialist, who realizes that this is an old injury with scarring. He and a friend made a potato gun. When it didn't fire, he looked down the barrel. It blasted his eyeball. He was afraid he'd get in trouble, so he told his parents he got a black eye roughhousing with said friend. He walked around for almost 2 years with a badly damaged eye. His vision will never be 100% BC. He waited so long. I went home that day and drove home the point to my boys that they would never be in trouble for coming to me when they get hurt, no matter what stupid idea they were executing. Had a mid-20s girl attend DEPT with a chest infection and generally lethargic, had her leg up with multiple bandages and sports socks over it and smelled terrible. On removing all of the dressings, I found the remains of an external fixator used for treatment of her ankle fracture. She had never attended any follow-up after being initially discharged and used pliers to take the fixator apart. Pus leaking everywhere. I touched one of the screws and it fell out her leg. The ankle felt like jelly, no bone strength at all. She went straight for OA+E to theater for amputation. Dermatologist here. I had a pleasant little old man come in for a routine skin examination. He had a large gauze pad on his right face that I, of course, asked about. He told me that he had a bad sore there for several months and he was treating with some Neosporin and wound dressings. I asked to look and underneath found a profoundly eroded portion of his face spanning from the right temple to the right lower jaw. I noticed a very clear visualization of his right zygomatic bone, masseter muscle, and trigeminal ganglion. For those non-medical folk, these are some very important deep structures. I also noticed he had facial weakness on his right side and speech slurring, which made it clear the nerve was significantly affected. He had no history of a stroke, so that was the only thing that made sense. What made this worse is that upon closer inspection the patient had several maggots and a botfly living in his face cave. I could see them wiggling right in front of me. When I mentioned it, the patient said yay, sometimes I can feel something crawling around in my head. Otherwise, he had very little pain. He was more annoyed that it continuously wept. For those questioning, this is an extreme manifestation of advanced basal cell carcinoma. The only option was radiation, which made the sight much worse. As of now, I think the patient is still alive, but it's only a matter of time before this does him in, or at least contributes to a very slow, very miserable downfall. Gratuitous plug. Get regular skin exams. Not me, but my mentor. He just graduated from optometry school the year prior, and he was in private practice when an older gentleman came in complaining of discharge coming from his prosthetic eye. Now, immediately he smelled a little off, but sometimes that happens when the elderly don't keep up with hygiene. Upon further questioning, color of discharge, how long has this bothered you, etc., my mentor asked when was the last time the prosthetic eye had been removed and cleaned. The man stops for a moment and says, well, I was discharged from military service at the end of World War II back around 1945, so this exam happened in 1986. This man has left a prosthetic eye uncleaned in his socket for over 40 years. You are supposed to remove and clean the prosthetic eye at least every week. When he took it out, there was a loud pop and the entire socket was oozing with green and yellow discharge. The smell instantly permeated the entire office, and it reeked for the next 2 to 3 days. Safe to say the other workers didn't want to return the next day because the smell was so overwhelming. Family medicine RN here. One time a patient of ours checked in a half hour late for her physical appointment due to public transit issues. Because of how late she was, the doctor wasn't able to see her, so she rescheduled, but she mentioned she had a question for the nurse if one was available. I brought her into an empty exam room and she told me her urine had been a funny color for a month or so, a brownish orange she had never seen before. No other symptoms whatsoever, just the color change. I had been at that job for about 2 years and the docs trusted my instincts, so I told her I could send in orders for some lab work and see what was going on. I ordered a simple urinalysis and urine culture and a CMP, complete metabolic panel, basically a battery of kidney and liver function tests. Several rounds of testing visits, a CT scan later, she was diagnosed with pancreatic cancer and given 6 months to live. I work as a surg tech in women's surgery. I have 2 stories. One, had a patient come up from the ER with what we thought was a pretty simple ectopic pregnancy, when a fertilized egg begins to form in your fallopian tube instead of the uterus. Doctor decided to do a laparoscopic approach because we thought it was caught in time and her bleeding seemed minimal. After placing our camera inside to look around, we found out that she had 2 ectopic pregnancies in each tube and an appendicitis. 2. Patient came in for a simple laparoscopic tubal ligation. Placing our camera inside, we found out that most of her large intestine had become wrapped around her uterus. Adhesions. The doctor took one look and said, frick no, I am not doing this here. She needed to go to a main or that would be able to handle the 3-5 hours of surgery that she would need done. TL.Dr. 1. Ectopic pregnancy turned into 2 ectopic plus an appendicitis. 2. Came in for no more babies. Left with a consult for a longer procedure. I broke my friend's orbital cheekbone in 3 places. He didn't go to an because he was a hockey player and there wasn't much for swelling. He lost feeling in half his face a few weeks later and lost muscle control on half his mouth and his eye drooped. He had an MRI done later that day and the bone had pushed back on the nerve bundle as well as against the ocular nerve. He has partial blindness now and regained most of the feeling to his face. He was drunk and wanted to box someone and karma won. I had the half facial paralysis happen to me spontaneously. Went to the ER because WTF, that doesn't happen without some kind of injury starting it. It does happen. Bell's palsy. That was a bizarre couple of weeks. My dad almost fainted. He called in sick and slept in all day. The next day he was still weak, so he went to the doctor. Turns out he had a heart attack that also tore a hole in his heart. This is almost always fatal. It was caused by a blood clot. The blood clot got stuck in the hole and saved his life. He was in a special hospital for months hooked up to a machine that pumped blood for him. Not me, but my ex is a nurse and they once had a patient who came in with some stomach pain. During the examination he mentioned he was also having some shoulder pain for a few months. They looked into it and it turned out most of his shoulder had been eaten away or was otherwise heavily infected with cancer. He died a few months later. Years ago my boss went in for a routine checkup and was immediately put in for emergency heart surgery. Surprise. Major heart blockage. Could have killed her even though she felt fine. Not a doctor, but once I went to the neurosurgeon with neck pain, have a cage in my lower lumbar, and they found that I was walking around in the world with my C1 in my neck broken in half. I rated my pain a 3. To this day, I don't know how or when it happened. I am a physician. Patient came into the clinic to get a second opinion of his scalp injury that he got in September. He is a mechanic and had hit the top of his head while he was under a car. Scalp lacerations tend to bleed a lot due to the vascularity of the scalp, so he was initially told to dress it regularly and it would stop. Well, it did not stop bleeding and the laceration seemed to get bigger. Now he sees us in December for this continuously bleeding wound. What started with a 4 cm laceration had evolved into this massive 10 cm gash just above his left ear. It just oozes bright red blood. The skin around the wound had become black and purple. It was obviously abnormal, so we biopsied it. It turns out that it was aggressive angiosarcoma, cancer, which has a very poor prognosis. We are planning a massive surgery to excise about 1/3 of the skin on his scalp. You need to get clear margins, so the excision is much larger than the lesion, as well a major reconstruction with skin grafts. This treatment is primarily palliative, that is, not curative. This will buy him a few months, but we can be sure that he has already metastasized due to the nature of the cancer. So, what started off with a simple laceration turned out to be terminal cancer. He likely already had this cancer brewing in this area, but the injury made it obvious due to its inability to heal. He likely has less than 2 years to live at this point. When I was around 12 years old, I had to have a root canal. After the drilling and procedure was complete, the dentist was cleaning out the newly drilled hole in my head with a toothpick-like swab. When I left the dentist, I told my mom I'm pretty sure the dentist forgot to take that swab out. She assured me he wouldn't forget that. 3 years later, at a new dentist, the x-ray revealed a toothpick-like swab in my head. Another partial root canal to remove it. I worked as a doctor in rural South India many years ago. I was visiting a friend in the village when his dad walked out of his house. Something told me that, while this man had no complaints, or attributed all symptoms to old age, he did not look good. I felt his left supraclavicular fossa, area above the clavicle at the root of the neck, and promptly felt a hard swelling. I advised my friend that his dad needed a checkup. In less than 6 months the old man was dead from gastric cancer. The hard nodule in left supraclavicular fossa was a lymph node to which the cancer had spread, is known as the sentinel node, the lymph node that points to a cancer in the stomach. During routine checkup, once examined a young lorry driver, 30-40 years old, with vague abdominal complaints. On examining him, his liver was enlarged and felt lumpy around the edges. Performed an ultrasound scan on him and found extensive metastases all through his liver. He developed jaundice and died in a couple of months. These findings were not really expected, and stand out in my memory after 15 years. My mum is an orthotist, works with eye doctors, and she told me about this one experience of her co-workers where a lady came in with a large hat and very dramatic hair. After being practically forced to remove the hat for an eye check, the co-worker was horrified to discover that the skin on her forehead and hairline was kinda melted and dripping down towards her eyes, which is why she was having eye problems. There was a large patch of her skull visible. Her son just shrugged and said that it started a few years ago and they just never got around to getting it checked out. Not a physician, but the patient. Went in for night terrors and a high fever after swimming in warm stagnant water. I'm an idiot. Sent to her for possible brain-eating amoeba. 1 spinal tap later, test came back negative. Unfortunately, spinal taps hurt like a bee after. You can't move your back because it hurts so stinking bad. Also unfortunately for me, I caught the stomach bug from the hospital as well. So for the next 12 hours I had to bend over to throw up, scream from the pain, and choke on my own vomit until I finally got it all out. Worst 12 hours of my life. Not a physician, but as a 15-year-old I sucked up a small piece of rolled up wrapping paper from a chewing gum while goofing around with a friend. I was the human vacuum cleaner. After this thing got sucked up I started coughing for a couple of minutes and got the feeling something is stuck in my throat. Went to see a physician to make sure. He saw nothing and said, if this thing would still be stuck somewhere I would be coughing uncontrollably. Fast forward 3 years later. Due to a chronic pneumonia that I developed, I went to a specialist that found unsettling shadows on an x-ray of my lung. His diagnosis: tuberculosis. Went to a hospital to get a final biopsy to make sure. Received a general anesthetic. When I came back to myself they told me that they found a small object stuck in my bronchial tubes that was the reason for the shadows and the chronic pneumonia I developed. They removed it and I was fine from that point on. The end. This is my dad's experience, not mine. This was not in a routine checkup, but still a good story. A guy came in without booking an appointment and a head covered in bandages. The bandages were drenched in blood. The guy refused to take them off. After much persuasion, my dad finally got this guy to remove them. He had a massive cut cutting his entire face in half, down the middle. One of his eyes was hanging out of the socket. Blood was everywhere. He was a lumberjack. And his story was that he was cutting a log. The chainsaw caught a hard piece of bark and it bounced up and sliced his face in half. The guy lived an hour away and drove an hour to get here. He didn't call 911. My dad forced him to go to the hospital, but the guy said it was fine and he could just walk it off. He ended up going to the hospital. Pediatrician was doing what we call a well child check on a 2-month-old. Mom randomly asks, what do I do when he turns blue? Apparently this baby would randomly turn blue 1-2x a week. Stop breathing. Mother would shake him, also far from ideal, and blow in his face and he would get better. Turns out the baby had Brugada syndrome. MS3 here. Had to admit a patient for my internal medicine rotation. His chief complaint was I tried to take off my shoe and my foot fell off. Guy had terrible diabetes and his foot was literally in his shoe and you can see bone on his leg. He didn't feel a thing. I will never forget that odor. My dad has always had issues with his urethra. I don't know the specifics, but he's had surgery around 20 years ago and had to occasionally put in a catheter to keep things open. So, he goes into the doc because he wants to get it checked out again and they say they need to do some minor surgery. This wasn't unexpected so he says fine, that works, move on. He starts going through the motions of getting things prepped to get the surgery done and they pull some blood, notice a high white blood count. I think it was white blood count at least. So they start doing checks for WTF was going on with his blood. Unfortunately, they find that he has a mass in his colon. Docs do a biopsy and find that it's cancerous and they need to do surgery on it. Well, crap. For this one, they need to do a stress test to make sure he'll survive the surgery. 5 minutes into the stress test, they stop him and he's like, wow, that was quick. I was expecting to have this go on for a while, to which they responded, we had to stop it because we thought you might pass out or have a heart attack. Medical folks do some tests and find that one artery is 100% blocked and 2 are around 80%. How he didn't have issues beforehand is beyond everyone. Dad overworked himself, worked a full-time job, volunteered, managed his local American Legion post, was an alderman for the city, and helped as a mentor for a few local non-profits. It also looked like he had had multiple small heart attacks in the past, which he either didn't notice or just ignored, either of which is pretty crazy. Ended up having to have a triple bypass, back to work 2 weeks later, and then had the cancer removed the following month, which was all followed by chemo. I was the dumb patient. Where I work we have a huge slide, one with sleds that roll down on skateboard wheels. It's basically a snow sled with a board and some wheels on a track about 150 feet long, meant for kids and adults to ride on. One staff member up at the top to keep things orderly and help with pushes. One staff member at the bottom to clear lanes and make sure no one gets run over. It's a ton of fun. The kids can run up and down the hill all day, but also kind of unsafe. After all, it's basically a few teenagers in charge of a homemade roller coaster, and we've had a few injuries before. The worst, until me, was a sprained wrist. Anyway, I was at the bottom on a rather slow day, just standing around because the kids were big enough that they were clearing the lanes for me. I saw a sled coming down with no rider. Someone had let it slip. So I stick out my leg to stop it and it slams into the middle of my shin. I didn't feel a pop or a crack or anything, just a solid thunk and then some hobbling around like I hit something in the dark. Few weeks later, I've got a bump on my leg from the stupid sled, mentioned it to the doc during my physical, touches it, feels the lump and asks if it hurts, only when someone touches it was a cracked bone and it healed lumpy. Never went to the follow-up because it stopped hurting. Probably not the worst thing to have walked in during a routine checkup, but hey, compared to a cold or strep throat, a cracked lumpy bone is pretty interesting. Not a routine checkup, but there was a patient who was checking in the morning of his planned nephrectomy, removal of his kidney. He said, I slipped last night and I think I broke my ankle. Go to examine him and he has an open fracture, bone sticking out of his skin. He ended up getting emergent orthopedic surgery and had his nephrectomy delayed. No idea why he waited until morning for that. I am an internal medicine resident and had a lady come in during my intern year for what she thought to be an asthma exacerbation. She smelled strangely. Thankfully I asked her to take off her bra to assess her breasts. Turned out that she had a fungating right breast mass and suspicion for meds lung on x-ray. PT was covering mass with tissues and said she thought it would go away eventually. Invasive ductal carcinoma stage IV. She was in and out of hospital for 1 year 6 months since her right lung contained a loculated pleural effusion and the lung had become so fibrotic SP multiple thoracentesis that she was constantly dyspneic and just recently passed away. Not a physician, but a nurse. Guy comes in for routine testing his primary physician had ordered. I'm checking him in and he asks me to please not put a blood pressure cuff on his left arm, because it might be broken. I look, and although I'm not in orthopedics in any way, it looks like it might be broken to me. It's purple, swollen to twice its size. Looks like he very possibly has a fractured ulnar. Turns out he was cutting wood in his garage the night before, pushing it into a saw. Somehow a piece snapped back and hit his arm. Instead of seeking urgent or emergent medical attention, he decided to come to his appointment with us as usual. We ended up cancelling his appointment because the procedure we do often involves blood thinners, which could be a major problem for his situation, and sending him to the ER. I still chuckle when I think of that, just his casual manner about the whole thing was very funny. When I was 14 I woke up with a puffy eyelid. My dad takes me to see the doctor, but a nurse was the only one available. She said I must have gotten into some weeds and had an allergic reaction. Here, put this cream in her eye. About 2 hours later I wake from a nap in agony and a temperature up to 102. Mum calls the clinic. Same nurse tells her to rinse my eye and I'll be fine. By that evening my temp was up to 104. I was having delusions. Still remember being on a boat with literary characters whose books I had been reading when they were told to get me to a walk-in clinic. Walk-in clinic turns us away to the ER, all while I'm puking in the backseat of the car. I end up with MRIs and CT scans and a team of infectious specialists. Turns out I had an abscess in my sinus cavity which was pushing my eye out of my skull. My lid couldn't close over my eye. I was in surgery shortly afterwards and didn't lose my sight, although they were worried. We were doing a medcap operation in Baghdad, basically free healthcare from the army for locals, and this older guy comes hobbling in and says he's got fever chills, and his leg hurts. We ask him to lift his disdasher, long, sort of like a dress but not really, so we can't take a look at his leg and it's 100% gangrenous from the toes up to his knee. Turns out he got an infected wound in his foot and it spread nearly all the way up his leg. Sent him to the local hospital for surgery and they cut most of his leg off. Dude survived though. Some was tough as nails. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.